Hi everyone, this is Dr. Rahul Khemani. I'm a consultant psychiatrist practicing at Heart and Mind Clinic in Borivali, West, Mumbai. I practice in the range of Malad to Mira Bainder, with my clinic being in the center, Borivali, West. I practice across all age groups, whether it is a child, an adult or an elderly individual. Problems such as anxiety, depression, bipolar disorder, schizophrenia or so on can be treated with the help of psychiatric medications and therapy as well. Today, we would be discussing a very interesting topic on workplace and stress. Workplace, as we all know, is a place that has become very heavy, and sometimes for some people use the word toxic. What is this culture and what is going on right now? If I remember correctly, almost 20-30 years back, there was a completely different system. People used to go to work comfortably, come back quite early in the evening, no mobile phones, not the smart era, I agree. They would chill at home, spend time with their family, go out with their children to parks, gardens, play with them. They would spend equal amount of time in work, in their own family, and then for rest as well. But unfortunately, the system has changed now. There are things that are much different now. You spend quite a lot of time majorly at workplace itself. There are no time defined for your work. You don't know when you are suddenly going to be called in. There are these different systems where you sometimes are working at home itself and you do overwork. Sometimes because you're traveling so much, the workplace is a bit far, there is a site visit, there is something coming up, it's the year end or something of that sort, and suddenly it all comes pouring down on your head where you are distressed, disturbed. So this work stress, nowadays people normally think it's kind of a badge of honor. You think that this is normal. This is something that you can tell people that yes, I am having a lot of work and I'm busy all the time. But is it really all the effort which is you're putting in worth it? No, it's just burning you, and that is the right correct word for it, because it leads to burnout. We don't acknowledge this burnout. Most of us, as well as our seniors, our bosses, our people who are taking supposedly care of us, actually just say that this is laziness, you are doing this on purpose, you're just procrastinating, you don't want to do the work. But no, this is not laziness, this is genuine, real burnout. What do you experience in burnout? What do you see when you are going into this burnout? This burnout is a set of kind of things that you experience. For example, you're not able to sleep well, you don't feel like eating much, you don't feel energy left in your body, you feel disinterested in everything that is going on around you, you can't think very clearly and you start forgetting things. A very apt word for it is you feel foggy, or some people very describe it as feeling very cloudy, and you can't be very analytical in that moment. You start feeling very tired of this experience that you have at your workplace. You take it out on your family, you get angry on your children, you don't support your partner enough, and you don't know where your life is headed towards. You don't get that break that you need. You just want to blast. And this burnout, this feeling of feeling hopeless, feeling helpless, feeling worthless sometimes because you're being scolded upon even with all the effort and work that you're doing, is important to be addressed. This is not any sort of laziness. A lot of people experience high functioning anxiety. This high functioning anxiety is something that is hidden behind productivity, because you are productive, you can work. High functioning anxiety means that you are somehow able to finish your work, and that is why it does not come out up until it is so late that you finally just break down and you can't do anything else, and you experience the highest form of anxiety because of it. High functioning anxiety is commonly seen in people who have a good amount of resilience, but despite you being able to cope up with it marginally, it is always better to take a step back, tell yourself that this is where you need to stop, relax, take a day away from everything and just come back and start wherever you have stopped, and you'll get it back, and you'll do it with much better energy, lesser time, and much more productivity than you actually thought so. This high functioning anxiety is a problem because it makes things unnecessarily delayed, and you end up having more trouble than you actually probably would have if you would have reported this a little earlier. A lot of things that we need to have in our workplace, but most importantly, one of them is having mental health days. When we are joining any company or something, we are told that you'll have these leave days, you'll have this space where you can take a break whenever you want to and everything. But you've never specified that you have mental health days. You can take an off whenever you feel that you don't feel like coming to work today, you feel a little gloomy today, you feel like, just chilling at home, and today specifically I want to do nothing. So these mental health days are shied upon. People feel scared of taking them, and whenever you take them, you have to probably get a certificate, arrange something, and people in your workplace look down upon you. You feel very embarrassed about it. It becomes heavy, it becomes unnecessary, and most of the people unfortunately do not take it. In fact, they prefer faking it into a physical health problem as compared to specifying it as a mental health problem. Luckily, a lot of workplaces have started allowing these and have been specifying these. There are so many corporate webinars being taken upon. There are so many psychiatrists, psychologists being called upon to speak about this, spreading awareness about anxiety and depression. And this is, I would say, the way forward. This is the way you need to move around and speak about your mental health freely in such a manner. Workplace problem is unfortunately sometimes also kind of taken upon as feeling ambitious, and people sometimes take it in the wrong way and think of it as this is kind of explanation that you're giving away. But that's not true. This workplace anxiety, workplace depression is very common. There is so much of bullying happening in your workplace. There are so many HR departments which are not so functional, not so supportive. There are so many unfortunate situations where people above you are really putting unnecessary and unbelievable pressure. These workplace relationships are sometimes making things a little complicated, and eventually in this scenario, it is natural that you would break down. So what can you do over here? What are the things that you should look out for? When you join a place, remember there is a rule of 8-8-8. 8 hours of work, 8 hours of family time, 8 hours of rest for yourself. Remember to take care of yourself even while you're working. Take short breaks. There is again one more good rule that you can follow. Working for 20 to 30 minutes, then take a 5-10 minutes break, go out, take a walk, listen to some music, just close your eyes and focus on your breathing. Learn to take a step back to heal yourself whenever you think it is becoming overburdening, whenever you feel that you can't deal with it anymore. Learn to delegate your work. Learn to be assertive. These are simple things that can just take away the pressure easily. It's important to take vacation days with your family, and these vacation days shouldn't happen just once in a blue moon. They should happen in a regular interval. Take short breaks, take long breaks. Workplaces allow you to do these things, but sometimes because we are scared, because we are ambitious, because we are looking at the long run, thinking that this is where we need to head, and the more we show ourselves as available, the better positions we'll get, we sometimes neglect our mental health, and that is the beginning of a downfall, which you can definitely avoid. So this workplace stress, anxiety, depression problems can be dealt with. Just consult your psychiatrist or psychologist and deal with it in the best way possible.